Skin cancer can affect anyone, and doctors say one of the most important warning signs is a spot that simply refuses to go away. At Epiphany Dermatology, doctors use a variety of tools to detect and treat skin cancer, including Mohs surgery. We visited the Epiphany Dermatologist to learn what patients should look out for. A spot on your skin may look harmless, even like an ordinary blemish, but if it doesn't heal, dermatologists say it deserves a closer look.
For Mohs surgery, the most common cancer is basal cell, and basal cell actually just looks like, it can look like anything. It could look like a blemish that just won't heal. It can look like a patch of dry skin, but the most consistent thing is that it doesn't go away.
One treatment option for certain skin cancers is Mohs surgery. The procedure allows doctors to remove cancerous tissue while preserving as much healthy skin as possible, making it particularly useful in areas where preserving tissue matters.
So Mohs surgery is a skin-sparing surgical technique to use to remove skin cancers. Typically on the head and neck, but other areas where the skin is tight, like the hands, the feet. Also for stubborn skin cancers, more aggressive skin cancers, larger skin cancers, so anything that needs to be sparing of as much healthy skin as possible.
And while skin cancer risk is often associated with older adults or lighter skin, Epiphany Dermatologist Dr. Toll says skin cancer can affect people of all ages and skin tones.
I've had patients as young as in their teens and patients older than 100. I've had patients of every race, every color, so more typically in fairer complexions, it's a little bit more predominant, but sometimes people with darker complexions actually aren't aware that they could be predisposed, and so sometimes those are caught later and more aggressively.
For Dr. Toll, treating patients is also personal. She is a cancer survivor herself, an experience that changed the way she approaches care.
I am a cancer survivor. I had breast cancer in 2019, and I kind of learned what it was like to be a patient, so I kind of revamped my whole practice style after that to kind of be patient-centric. I also realized the importance, and I think I always knew, but really focused on it as a kind of a basic foundation principle of my practice, is that it's a team approach.
That approach starts with detection. Doctors say you don't have to diagnose a suspicious spot yourself. The important thing is knowing when to have it checked.
So if they notice a spot, if it's been around for more than a month or two, it doesn't seem to be going away, I would say go see a dermatologist or your primary care doctors.
And for patients who need more than a routine skin check, Epiphany Dermatology offers care that goes beyond detection. From comprehensive dermatology exams to skin cancer diagnosis and treatment, the practice brings specialized expertise and a patient-focused approach under one roof. The goal is comprehensive care with the patients at the center, helping people recognize problems early, understand their options, and get the specialized treatment they need. It really is your one-stop shop for healthy and glowing skin. Epiphany Dermatology, they have locations across the St. Louis region, so to find the nearest one near you or learn more, you can visit their website. And as always, check out kck.com/showme.